Direct primary care is a common sense approach to take care of the needs for so many people, and then you just incorporate the wellness piece into it very easily. It's like, this works, this is affordable, this does not require thousands of dollars per month to have wellness. So I used to do primary care starting back in 1997, so I've been practicing for many years. So then in 2014 is when I started introducing the concept of bioidentical replacement therapy. Really still didn't quite grasp it, but now that I've had more, I'll call it seat time or clinical time of practicing this way, I would never go back to that conventional, I call it the sickness model. It is a sickness model, and the changes I've seen in my patients doing what I call the wellness model, it's changed my own life. And I love practicing. I love practicing. And I feel bad for my physician colleagues, nurse practitioner colleagues that are still in the sickness model, and they look at me and they go, oh, I'd love to do what you're doing, but I don't understand it. And then back to the trenches they go. Coming from the sickness model, where you're seeing 25 to 30 patients a day, and then you go home and you're charting until 10 or 11 o'clock at nighttime, and you're really not making a difference in their life. You see them back 6 months later or a year and nothing's changed. To now, because what I'm doing is a membership-based model, so I kind of moved entirely away from the insurance model. I get to spend 45 minutes to an hour with my patients. I get to communicate with them in ways that really helps to personalize and individualize what I'm doing for them. The qualitative difference is huge. Qualitative for not only the patient, but also for my own personal practice and kind of balancing work and life. If I could only go back 20 years, I'd love to be practicing the way I am now. Patients love it. They love, again, the personalized approach to it. They have my email, they have my text. Now all that gets incorporated into the electronic medical records, because there's a lot of good direct primary care EMRs that aren't designed to make bean counters or accountants happy. They're designed to make the practitioner, the clinician happy, because they're user friendly. So patients love that, wow, they can text me and I'm texting them back and forth. They might have a question about, I realize when I'm in the room educating the patient about everything we do, maybe 30%, maybe 40% really sticks into their mind. And so I give them the freedom, you're gonna have questions. Ask me those questions. Send me an email, send me a text. And I respond to them, they go, oh yes, that's what you told me. So it's those things that really have made the direct primary care model, again, more personalized, more individualized.